Welcome to another fun and exciting series of our monthly mental health talk show, Sip
and Chat.
I'm your host, Deborah Bloom, and I'm a licensed mental health professional working with postpartum depression and women-related issues. And this is my beautiful and lovely co-host,
Amanda Gergel. Hello, everyone. I'm licensed here in Florida, licensed mental health counselor. I specialize in working with teens, adults, and children in an array of different concerns, emotionally and behavioral.
Now, thank you so much, Amanda. Last time we spoke, we touched on the warning signs for mental health.
Right.
What should individuals be aware of? And once you are aware of those signs, finding a clinician, building the rapport with that clinician, what are the next steps?
That's a very good question. The next step is once you have your appointment to show up for.
Yeah.
Once you show up,
Please show up.
Yes, please show up. Usually prior to showing up, the office administrator will send some intake paperwork to be completed.
Mm-hmm.
If she didn't send it or if you can't complete it, you can complete it upon arrival. It's basic demographics of your name, your insurance information or pay out of pocket, your history and some symptoms. And once that information is completed, the therapist will come and, conduct the assessment in a private setting. Usually takes about an hour and a half. And that's just the time dedicated to you to get more information about you.
Wonderful.
And Deborah, can you tell our audience a little more about the assessment process?
Sure.
And what that looks like?
Of course. So an assessment is one of the first things that we do. And it is about, I want to say, an hour to an hour and a half of questions that we ask individuals in all areas of life. So we ask questions based on their occupation, on their relationships, on social settings, cultural settings, religious affiliations, past and current mental and medical history, anything that we should know about, maybe familial issues that they've had in the past, symptoms, what the severity of your symptoms, and what they want to see as a result, of being there with a therapist. And we ask about what strengths they have and maybe even effective coping strategies that they've had and used in the past.
Okay, so pretty much, a full, a picture of what's going on in your life and how it's impacting your function. And it's a two-way, it's like, it is an assessment, but you're there to ask questions as well.
Mm-hmm. Yeah, exactly. So we have a full array of a snapshot of your entire life so we can come up with a provisional diagnosis. And once we have that, we can form the next steps towards treatment. So Amanda, why don't we help our audience understand what are some of the most common diagnoses out there?
Okay. Well, anxiety and depression seem to be the top. Over 40 million adults and children suffer with anxiety. And for adults, it's anxiety, it's depression, it's ADHD, it's adjustment disorder. And then for children, the most common I see is also ADHD, any behavioral concerns, adjustment, bullying, and different things like that.
Awesome. Great, Amanda.
So, Deborah, after the assessment, there's a diagnosis, you reach a diagnosis. What are some additional supporting tools that a therapist can use, during the assessment process?
Sure. Thanks, Amanda, for asking that question for our audience. So during that process, we can use some different rating tools, some rating scales. And one of them is called the Beck's Inventory, which is an assessment tool used to measure the severity of someone's symptoms as it relates to either anxiety or depression. It's a self-rating tool. So for example, if an individual rates anywhere from 0 to 10, it could indicate like an up and down.
Right, something normal that you can see.
Which is kind of normal. Now, if an individual score is between 31 and 40,
then it can be severe depression. And when we say normal, it means, your functioning is not too impacted, compared to when we see a severity of depression, like your sleep, your working, you can't function, your relationship. So it helps us understand more of the severity of the depression or the anxiety so that we can include that in our treatment planning.
Yeah. Wonderful. That was a really, really great explanation. Now, another one that we use is called the Vanderbilt assessment, and it is used in two settings, at the school and at that home. And it guides the teachers and the parents to understand the level of attention deficit disorder, ADHD, that child is having, so we can make an accurate, informed decision whether or not that child actually has a diagnosis. So then the teacher would complete one, the parent would complete one, and once both parties have completed, they would then submit it to the provider for that proper assessment.
Correct. And these scales are very useful because it helps inform the professional what's going on, especially like with the Vanderbilt, children might display attention difficulties, but it can be underlying anxiety or underlying depression depending on what they're going through. So during the scales, they range in different numbers to see exactly if they actually have the diagnosis of ADHD.
Correct. Depending on what you do, we can pick up on other symptoms as well that child might be experiencing. Now, I'm going to move on to ask Amanda here, why is diagnosing so important?
That's a great question, Deborah. Diagnosing is so important because, it helps with the treatment plan. So the more that we know how to come to an accurate diagnosis, the more we can help stabilize your life, your functioning, your symptoms, normalize them, and bring you to a better level of happiness and whatever that looks like for you, if it's in a relationship, if it's at work. So having a diagnosis creates a pathway for us to have treatment. And the treatment pretty much includes, what your symptoms are and how we're going to help you cope with it.
Going on, so we can either give you a correct form, maybe an evidence-based treatment, maybe an intervention that is going to be on more of a holistic kind of modality. Now, this brings us to our end of our segment here, and I kind of just wanted to leave everybody off with the tip of the day. What is something that we can tell our audiences?
I think a good tip of the day is the more you know, the more you grow. So understanding what you're going through, your symptoms, and how it's impacting you, the more that you understand it, the more it's going to help you change. And that's what we're looking for, positive change in your life.
Yeah, and I think that the more that you are aware of it, the more that you can advocate for yourself. And by being able to come out and say, hey, I suffer from postpartum depression, or I have bipolar type 1, it gives you sort of this freedom to advocate for yourself, others, find a community of like-minded individual, and I think from that you grow, you empower yourself and others towards this movement of change.
Great explanation.
So thank you so much, guys. Amanda and I are really grateful. We hope that the information that we have provided for you today was not only educational but informative. And I guess what we should tell our audiences if they have questions.
If they have any questions or concerns, please leave us a comment. You can email us. We're here to help you in any way we can. And we know that it can be a little bit confusing and difficult, and the purpose of our videos is to help you through that process. So again, just leave us any comments, email, anything, whatever method is best for you.
Yep, guys, and thank you so much for watching. We're so grateful. Beijinho.
Bye.
Ciao, ciao.